Welcome back. Today we're discussing a gentle stretching movement that can be particularly beneficial for women over 50 who experience tightness in the hips, inner thighs, or pelvic area. This exercise, commonly called the butterfly stretch, addresses flexibility and comfort in areas that often become restricted with age and prolonged sitting. Before we begin, remember this is educational content, not medical advice. Always consult your healthcare provider before starting any new exercise, especially if you have existing health conditions or recent injuries. If you find this information helpful, consider subscribing for more practical guidance on movement and wellness practices that support healthy aging. Let's explore why this particular stretch can be valuable and how to perform it safely. The butterfly stretch primarily targets the adductor muscles, the group of muscles along your inner thighs. These muscles play several important roles in daily function. They help stabilize your pelvis during walking, support hip movement, and influence overall lower body alignment. As we age, these muscles often become tight for several reasons. Prolonged sitting, which many of us do daily, keeps the adductors in a shortened position. Reduced overall activity means less movement through the full range of hip motion. Gradual loss of flexibility, which is a normal part of aging, affects these muscles just as it does others throughout the body. When the inner thigh muscles become chronically tight, you might notice several effects. Hip mobility may feel restricted, making certain movements like getting in and out of cars more challenging. Lower back discomfort can develop because tight adductors influence pelvic alignment, which affects the spine. Some people experience a general sense of stiffness or heaviness in the lower body. The butterfly stretch addresses these issues by gently lengthening the adductor muscles and encouraging better hip mobility. Let me explain how this stretch relates to circulation, as this is often mentioned but rarely explained clearly. When muscles are chronically tight, they can somewhat restrict blood flow through the area. This isn't dramatically cutting off circulation, but rather creating a less optimal environment for fluid movement. By regularly stretching and releasing tension in the inner thighs, you're helping maintain better circulation through the lower body. Additionally, the gentle pulsing motion sometimes used with this stretch can have a mild positive effect on lymphatic drainage. The lymphatic system, which helps remove waste products from tissues, relies partly on muscle movement to function. Gentle, rhythmic movement can support this process. What does this mean practically? Some people report that after regularly practicing this stretch, their legs feel less heavy or tired at the end of the day. Mild swelling in the ankles that comes from prolonged sitting may improve. These aren't dramatic transformations, but rather subtle improvements in comfort and function. Now let's discuss the connection between hip flexibility and pelvic floor function, as this is relevant for many women over 50. The pelvic floor is a group of muscles that supports your pelvic organs and plays a role in bladder control, among other functions. These muscles don't work in isolation. They're influenced by the muscles around them, including the adductors and hip rotators. When the muscles surrounding the pelvis are very tight, this can affect pelvic floor function in two ways. First, chronic tightness can contribute to general tension in the pelvic area, which isn't ideal for optimal muscle function. Second, tight hips can influence posture and pelvic alignment, which indirectly affects how well the pelvic floor muscles can do their job. The butterfly stretch, by addressing hip flexibility and reducing tension in the surrounding muscles, may support better pelvic floor function as part of a comprehensive approach. Some women find that regular stretching of the hip area, combined with other appropriate exercises, helps with issues like mild stress incontinence or the feeling of pelvic heaviness. This doesn't mean a single stretch will solve complex pelvic floor issues, but rather that it can be one useful component of supporting this area. If you're experiencing significant pelvic floor concerns, working with a pelvic floor physical therapist is the most effective approach. They can provide targeted exercises and techniques specific to your situation. Let's talk about the relationship between hip tightness and lower back discomfort, as this connection is important and often overlooked. Your pelvis serves as the foundation for your spine. When the muscles that attach to your pelvis, including your inner thigh muscles, are unbalanced or tight, they can pull on the pelvis in ways that affect spinal alignment. Specifically, Tight adductors can contribute to pelvic rotation or tilting. When your pelvis isn't in its optimal position, your lower spine has to compensate, which can create strain and discomfort over time. Many people focus on strengthening or stretching their back muscles when they have lower back issues. While that can be helpful, addressing hip flexibility, including the inner thighs, often provides significant relief because it addresses contributing factors rather than just symptoms. The butterfly stretch is particularly effective for this because it targets muscles that directly attach to the pelvis. As these muscles release and lengthen, the pelvis can settle into better alignment, which often reduces lower back strain. You might notice after several weeks of regular practice that getting up from sitting feels easier, or that general stiffness in your lower back decreases. These improvements come from better overall alignment and reduced compensatory tension. Now I'd like to address something that's sometimes discussed around stretching and emotional well-being. Physical tension and emotional stress are connected, though not in the mysterious or metaphysical way sometimes suggested. Here's what research actually shows: chronic stress activates your sympathetic nervous system, which can increase muscle tension throughout your body, including your hips and pelvic area. When you practice slow, mindful stretching with deep breathing, you're activating your parasympathetic nervous system, the part of your nervous system associated with rest and recovery. This physiological shift can help reduce overall tension and promote a sense of calm. Some people do experience emotional responses during stretching, particularly in areas like the hips where we tend to hold chronic tension. This isn't because emotions are stored in tissues in a literal sense, but rather because releasing long-held physical tension while in a relaxed, mindful state can sometimes trigger emotional responses. If you find yourself feeling unexpectedly emotional during or after this stretch, that's a normal human response to relaxation and release of tension. It doesn't mean something is wrong or that you're releasing stored trauma. It simply means you're accessing a state of relaxation that your body perhaps hasn't experienced in a while. The calming effect of gentle stretching combined with conscious breathing is well documented and can be beneficial for managing everyday stress and promoting better sleep. Let's discuss how hip flexibility relates to posture and spinal health. Good posture isn't about rigidly holding yourself in a certain position. It's about having the flexibility and strength to move comfortably and maintain alignment without excessive effort. Tight hips, including tight inner thigh muscles, can limit your ability to sit or stand with optimal alignment. When your hips are restricted, you may compensate by rounding your back, tilting your pelvis excessively, or shifting your weight unevenly. The butterfly stretch helps address this by improving hip flexibility, particularly in the movement called hip external rotation and abduction. This improved mobility allows your pelvis to sit in a more neutral position, which supports better spinal alignment. Over time with regular practice, you might notice that sitting feels more comfortable, that you're able to maintain upright posture with less effort, or that certain movements feel smoother and less restricted. This isn't about achieving perfect posture, but rather about giving your body the flexibility it needs to move and position itself comfortably throughout daily activities. Now let me walk you through how to perform the butterfly stretch safely and effectively. Find a comfortable place to sit on the floor. If sitting on the floor is difficult, you can sit on a folded blanket or cushion to elevate your hips slightly, which makes the position more accessible. Sit with your spine relatively upright. Bend your knees and bring the soles of your feet together, letting your knees fall open to the sides. The closer you bring your feet toward your body, the more intense the stretch will be, so start with your feet at a comfortable distance, perhaps 8 to 12 inches from your body. Place your hands on your ankles or feet, or rest them on your thighs or the floor beside you, whatever feels most comfortable. Here you have two main options for practicing this stretch. The first is a static hold. Simply sit in this position, keeping your spine long, and hold the stretch for 30 seconds to 2 minutes. Breathe normally and allow your muscles to gradually release. You shouldn't feel pain, just a gentle stretch sensation in your inner thighs and groin. The second option is a gentle pulsing or fluttering motion. From the butterfly position, gently press your knees down slightly, then release, creating a small, controlled bouncing motion. This should be very gentle, not forced. The motion comes from your hips, not from pushing with your hands. Perform 20 to 40 of these gentle pulses. Some people prefer the static hold, others prefer the gentle movement, and some combine both approaches. Experiment to see what feels best for your body. Important form points: keep your spine relatively upright rather than rounding forward excessively. If you do lean forward to deepen the stretch, hinge from your hips rather than curling your back. Never force your knees toward the floor. Gravity and time will gradually increase your flexibility, forcing only risk strain. Breathe steadily throughout. Deep breathing enhances the relaxation response and helps your muscles release. If sitting on the floor is uncomfortable or not possible, you can modify this stretch. Lie on your back in bed or on a mat. Bend your knees and bring the soles of your feet together, allowing your knees to fall open to the sides. You can place pillows or cushions under your knees for support if needed. In this reclined position, simply rest and breathe, allowing gravity to gently stretch your inner thighs. You can stay here for several minutes as a gentle, restorative stretch. This reclined version is excellent for people with back issues, limited floor mobility, or those who simply prefer a more relaxing approach. How often should you practice this stretch? For maintaining hip flexibility, 2 to 3 times per week is beneficial. If you're experiencing significant tightness, you might practice daily until you notice improvement, then reduce to several times weekly for maintenance. Each session doesn't need to be long. Even 2 to 3 minutes of mindful stretching can provide benefits when done consistently. Now let's discuss who should be cautious with this stretch or modify their approach. If you've recently had hip, knee, or pelvic surgery, get clearance from your surgeon before attempting this stretch. The butterfly position puts the hip joint through a specific range of motion that may not be appropriate during certain recovery periods. If you have a groin strain or recent injury to the inner thigh muscles, avoid this stretch until the acute injury has healed. Stretching an injured muscle can delay healing and worsen the injury. If you have severe osteoporosis, particularly in your hips or pelvis, consult your healthcare provider before practicing this stretch. While gentle stretching is generally beneficial for bone health, certain positions may need modification based on your specific situation. If you experience sharp pain during this stretch, stop immediately. Sharp pain is different from the mild discomfort of a gentle stretch. Pain indicates you're either stretching too intensely or that the movement isn't appropriate for your current condition. Pregnant women should modify this stretch or avoid it, particularly in later stages of pregnancy, as the hormone relaxin increases joint laxity, making overstretching more likely. If you have a history of blood clots or vascular issues in your legs, consult your doctor before beginning this or any stretching program. The key principle with any stretch is to work within a comfortable range. You should feel a gentle pulling sensation in the target muscles, but never sharp pain, burning, or discomfort in your joints. Let me share some realistic expectations about what this stretch can and cannot do. What it can do: improve flexibility in your inner thigh muscles over time with consistent practice. Support better hip mobility for daily activities. Contribute to reduced tension in your lower back when tight hips are a contributing factor. Provide a relaxing, calming practice when combined with mindful breathing. Support overall lower body flexibility as part of a balanced stretching routine. What it cannot do: dramatically change your body composition or appearance. Cure serious pelvic floor disorders without other interventions. Replace medical treatment for conditions requiring healthcare. Provide overnight transformations in flexibility or function. Address all causes of lower back pain, as back pain has many potential contributors. The most beneficial approach is to view this stretch as one useful tool in your overall wellness practices. Combined with other appropriate exercise, good nutrition, adequate sleep, and stress management, it contributes to your overall well-being and functional fitness. Some practical tips for incorporating this stretch into your routine: consider practicing it in the evening before bed, as the relaxation response can support better sleep. You might practice it after a warm bath or shower when your muscles are already warm and more pliable. Some people enjoy practicing this stretch while watching television or listening to music, making it a pleasant daily ritual rather than a chore. Keep your expectations realistic and be patient with your progress. Flexibility improves gradually over weeks and months, not days. Consistency matters more than intensity. A gentle stretch practiced regularly will provide more benefit than an aggressive stretch done occasionally. If you enjoyed learning about this stretch and found the information helpful, let me know in the comments. What other areas of flexibility or mobility would you like to learn about? Consider subscribing to receive more practical, evidence-based guidance on movement practices that support healthy aging. We focus on accessible information you can actually use, presented in a straightforward way. Remember, maintaining flexibility as we age isn't about achieving extreme ranges of motion or comparing yourself to others. It's about preserving the mobility you need to move comfortably through your daily activities and maintain your independence and quality of life. Start where you are, practice consistently, and notice the subtle improvements over time. Your body appreciates regular, gentle attention much more than occasional intense efforts. Thank you for watching. Take care of your body with patience and consistency, and it will serve you well for years to come.